Well, hello and welcome to all of our viewers from around the world. We are so glad that you've taken a little bit of time out of your day to come and join us. We've got some really exciting content coming up here, and I want to direct your attention now. You can even pause the video just for a second to pop over to our goldmidwifery.com website. That is where all the content is going to be coming up really soon for our 10th year in Gold Midwifery. How exciting is that? So we are bringing you an absolutely fantastic program this year. We're so excited about it, but we need you to come and engage with us. We want to hear about what you're doing in your practice, where you are in the world. We want to hear about some of the struggles, some of the exciting things, some of the things that you've been able to change through advocacy. It's going to be so good to share in all of that content together. There's lots of opportunity. The conference begins on February 5th for most of you, so check your time zones, of course, around the world. And of course, I've got a speaker here to introduce to you to here today. And I'm so excited to have Autumn Fuselier with us here today. I have to tell you, Autumn and I have been having some fun today with her presentation. It is one of those presentations you don't want to miss because we are going to be running some really exciting case scenarios. And this is like your opportunity to do like a ride along, I call it, because it means that you can really learn more and exchange ideas with your colleagues. Autumn, tell the audience how much fun we've been having today, just working out all the details for your presentation.
Oh my gosh, I feel like we have so many ideas just swirling around our heads, and it's been so much fun to help nail those down to what will work the best and help everybody absorb some of this information.
Yeah, and that's one of the key things. We know as learners, we all learn so differently. So we're trying to achieve, some goals here, lofty goals that when all of you come to us, there'll be a multitude of ways that you can learn this topic. Now, Autumn, what is your topic again? That's right, we're talking about hypertension. This is really a hot one here. So Autumn's presentation title is Improving Outcomes for the Dyad, Identification and Management of Hypertension in Pregnancy. Whoa, that's a big one. I have to say, you've taken on tackling this big job here, but we know you're up for the challenge. So let's just wind back a little bit here. I would love it if you could introduce yourself formally, tell folks where you are in the world and what does your day-to-day look like?
Yes. So my name is Autumn Fuselier. I'm sorry for the very difficult last name. So I actually live in Central Texas, pretty much smack dab in the middle of it, of course, in the United States. We are very good distance to all the major cities, Houston, Dallas, Austin. So it's a lot of fun to be here. So I am a certified nurse midwife and have a doctoral degree from Frontier Nursing University. And that is also where I did my master's and specialized in nurse midwifery as well. So day to day, I was a hospital-based midwife for several years and then moved into actually owning my own practice and a birth center. Hypertension is extremely important to me. It's something that I think a lot of people aren't very comfortable with. And I hope that is my goal for this, is to get everybody a little bit more comfortable with it. Because it really is such a public health threat. I mean, we're going to talk about that during the presentation. It is a public health threat. It is one of the leading causes of maternal mortality, and it's very important for us to understand it and be able to be comfortable with diagnosing, treating, and asking for help when we need it. That's another thing we'll talk about.
Right. Yeah. And we were talking about, really it is, this is right across, this is a public health crisis of sorts because it is being misdiagnosed, not identified early enough. And we are seeing deaths in our communities. And it's very devastating because essentially, we can come in much sooner and, bring treatment to our parents, our mothers, and really prevent these deaths from happening. But not only that, it can just lead to so many difficult complications, and sometimes we're seeing trauma on the other side of this too, where there hasn't been the adequate treatment or the as I mentioned, misdiagnosis. Tell me what you see in your practice. Are the women scared? Are they talking about it more? Are they identifying it sooner? I know that you communicate really well, but tell me, I know that you have women that come in and see you. What's been happening, in your neck of the woods?
Yeah. So I will say, I think there's a little bit of a difference between the practice I was at versus the practice I now own. We focus heavily, and this is another thing I do want to talk about in this presentation. We focus very heavily on prevention. And I would say the practice I came from, people weren't very aware of it. They didn't really know things to do to help prevent it. They didn't know their risk factors or how at risk they were for developing hypertension or preeclampsia, some of these more severe complications.
Right.
There's definitely a lack of education around it, and therefore more discomfort with the topic.
Right.
In my current practice, I feel like we have a very big wellness approach, and talking about some of those integrative things that we can do to help reduce their risk. And I think when we talk about it more, I think it's a scary topic for most people, but when we start talking about it and really learning how can we prevent these things, it makes people a lot more comfortable, the general public and providers.
Right. Yeah. And I think it's about building confidence without fear, and I know that a lot of these difficult topics, there ends up being this message of fear mongering. And I think that's why we've shied away from it, or, communities have sometimes. I love the idea of having this, obviously preventative is really one of the key things we see right across the board when it comes to midwifery care. It's the ideal. Let's say it's the ideal, right? That's what we want. And even if we're working in a facility where the ideal, doesn't play out for everybody, but as individuals, we're on fire for it. Will you be able to help us talk through some of those things as well, and identify where we can make improvements? If we haven't got everybody on board, like, is this something that you're, excited to share about?
Absolutely. Absolutely. The presentation will talk us through some of the physiology and some of the science behind why we're seeing what we're seeing, and getting everybody more comfortable with the actual, what are the diagnostic criteria, what are the things we need to do about that, but also diving into some of those things of how do we prevent this, how do we get comfortable with talking about this, how do we manage this so that it becomes less of a public health threat.
Yeah, absolutely. That's going to be so good. Now, I will mention again, your presentation is going to be unique again at the Midwifery Conference, because we've got, I would say, really good case scenarios coming. I can guarantee you that. But the key things are going to be that it's going to be super interactive. So we need everybody to come on board with this, right? We want to invite them in, get ready for some pre-homework that's going to be online that you'll be able to do before the event to get you really set up and situated. Just some things that you can connect with, not mandatory, but we're going to invite you in, to just participate. And then when you come on the day, get ready to, be brainstorming and coming with some answers, and sharing. We want to hear everybody's sort of share on this too, because we know that some of you are, very well established in your practice. So we want you to be coming on with those that maybe aren't, or those that just want to, really up their game in education. Because I think that's the key thing. Forever learners when you're in the birth world, right? We're always establishing new levels of education for ourselves because we love to learn. And this is something that really you have found yourself in that situation now. You just forever learning. Tell me, I want to know a little bit about how you tick, honestly. Why is it that you wanted to talk about this topic specifically, and and how did it grab you, and what did you learn from it?
I honestly think it relates back to my ICU days. So I was actually an ICU nurse prior to becoming a nurse midwife. So I feel drawn almost a little bit to more of the complications and higher risk conditions than I feel like most of your typical midwifery members of the community would
Right.
be.
Yeah.
The physiology behind it is so interesting, and we don't even understand all of it yet. So that played a role for me, just diving in to really understand what in the body makes this happen and how can we fix that the best way. And also because it is, I feel like, such an underserved topic. It's getting more attention, thankfully, lately.
Sure.
But things like postpartum hemorrhage, being specific, or shoulder dystocia, we have lots of tools, lots of toolkits that have been created. And this is one that is just recently getting all of that attention. And how do we standardize and make toolkits and protocols for how to make this happen? So I think that's what really grabbed me about it. And I do hope everybody is as passionate as I feel about this. after
Yeah,
watching.
well, this is their opportunity, right? That's what we've been talking about. So we're going to invite everybody online to come and join us on the day live. So just to let you know, Autumn's going to be here live, lots of opportunity to engage, chat. If you can't make it to the live event, we completely understand. It will be recorded for your convenience. And so you can roll back and come in and listen to the recording. And of course, I mentioned some of that pre-homework. So lots and lots of ways just to learn on this topic and grow in your practice, I would say. Thank you so much, Autumn. I have to say that it's just been such a delight working with you, and we're going to get to spend some more time together as well with our audience, which is going to be fantastic. Just really appreciate your time today.
Yes, thank you so much. I'm very excited to get to interact with everybody and continue working with the team.
That is wonderful. And as I mentioned, the topic title is Improving Outcomes for the Dyad, Identification and Management of Hypertension in Pregnancy. You can find all the details online right now at goldmidwifery.com. You can register for the event, still got some savings happening there. And of course, we have some open keynote access to you as well, free of charge. You can register today. I can't wait to see all of you online for this event. Thank you again for joining me here today, and we'll look forward to seeing you very soon. Bye-bye for now, everyone.